kind of thing. Yeah.
Okay. So now that we've established how that then is spread, right? One then asks the question, you look at the work that is going into DRC to treat the sick, to ensure the spread does not get there. Uganda has to be given its flowers for managing to handle the issue. Now they are Ebola free. But that does not mean that it still cannot spread to other jurisdictions.
True.
Now enter Kenya. We know a lot of work has gone into the same. But how would you look at the ground that we've covered in terms of preparing ourselves against the disease, because you also can't tell who has it easily.
That's true. So initially when the outbreak was declared in the DRC, that was in April, we did an assessment internally, or rather within the Kenya National Public Health Institute. We did an assessment of our preparedness. How prepared are we? And we scored 66%. And it's important to be truthful so that you know what to work at. And it is true. It would be low, would consider that low. A score of above 80 is best. Would consider that low because we are naive in Kenya to Ebola. We've not really dealt with it. We've dealt with Marburg, but it was in the 70s, I believe, late 70s. It was just one case, if I believe. But after that, we've really not dealt with Ebola. So our health workers are not adequately sensitized. Our services are not up to par. So that assessment gave us a direction. Where are we going to put our efforts in? 66 means there are some things we're doing very good in. That's surveillance, contact tracing. If someone was to be infected and we need to get their contacts, we're very good at that. But there are areas where we're failing. That's infection prevention and control, specifically for health workers, how to protect themselves. We are not doing very well in the what we are calling our infectious disease units, where we would treat patients and keep them in a way that they do not infect those who are caring for them. So those are the things now we have been working on. And I'm very happy and proud to say that after about 3 months of preparation, we've increased that score to almost 90 now, to almost 90. But in our public health space, especially for outbreaks, we say the real test is an actual outbreak, but we are not praying for it at all.